Right now, for the latest on the COVID-19 pandemic, I want to turn to Dr. Kate Tulenko. She's CEO of global health firm CORVUS Health. Always good to have you with us.
A pleasure.
So first, I want to start with this record-breaking case count on Monday of 1 million in the U.S., with the caveat that many may have been backlogged cases from the New Year's weekend. What's your reaction to this, as well as Biden's latest comments and plans to all this?
Well, I think the 1 million record, it was to be expected with the holidays and a lot of people in more contact, and also the backlog over the holidays as well. You know, there's new evidence coming out that Omicron is about 30% more infectious than Delta. So we're going to see a lot more cases with that. In regards, what Biden said, he's once again urging people to get vaccinated, get boosted. They're trying to get out more testing kits. I mean, that has been a huge disappointment that 2 years into this, we still have a shortage of testing kits. They're also trying to see how they can help hospitals. It really varies region by region, but there are hospitals in major metropolitan centers which are overwhelmed in the US and the UK, as you just heard in your last report. So there is concern because even though Omicron tends to be less severe, when you have larger numbers of people infected, you're going to have more people die. And in fact, we've seen it varies state by state, but many states, the rates of COVID infection have been much higher than last year, but the deaths have been lower or about the same.
And obviously, we're seeing schools increasingly making this decision now to either delay opening or go back to virtual classes. What do we know about the impact of Omicron in this latest wave on children?
Well, we are seeing more children hospitalized and hospitalized with more severe COVID illness, and we are seeing more child deaths. And we think that this is really more about the numbers game of the high number of children being infected rather than COVID being more severe or Omicron being more severe in children. And I do expect once schools reopen, many of them have been closed in New England due to the high snowfall. But once they reopen, I expect to see cases spike and see an increase in hospitalizations, both of children as well as adults, their family members.
So then, as you mentioned, then perhaps seeing another spike after the children do come back. Do we have a sense yet then from the data as to when the U.S. might see an Omicron peak?
I think looking at both South Africa, which was the first country to report Omicron, as well as the UK, I think we can expect it to peak at the end of January, so in about a month. By then it will burn itself out, through the schools and through the general population. And I think in the meantime, we really need to emphasize that people upgrade their masks. If you're currently using a cloth mask, consider a surgical mask or a surgical mask under a cloth mask, or upgrade to an N95 and continue to do that layered approach of protecting yourself, social distancing, good hand hygiene, avoiding high-risk situations.
And as you mentioned, the UK, South Africa, what have other countries' experiences with the variant really taught us or shown us?
Well, one thing they've taught us is that COVID is very tricky and that it can keep on throwing curveballs. We thought that maybe the next variant would be very similar to Delta with similar infection rates, but having such a mass of people infected really has overwhelmed the system. So it shows that when you're dealing with a new pandemic, or a disease that the world hasn't experienced before, you have to cover all bases and be as prepared as possible. And unfortunately, when you look at how most countries have handled this, they haven't been prepared.
So then what about expectations for compliance with some of these federal vaccination deadlines for healthcare workers in some U.S. states in an effort to really sort of help contain COVID more?
So in about 25 states, the courts have thrown the federal mandate out. So there's still 25 U.S. states that do have the federal mandate, and the Supreme Court is going to be hearing arguments about that case this Friday. But as the law currently stands in those 25 states, health workers will need their first COVID vaccination by the end of January and their second COVID vaccination by the end of February. But a concern, for me is 2 years into this, there really has been no large-scale effort to train more new nurses, to train more new physicians or other healthcare workers. And by allowing health workers or making health workers work while ill, you're really endangering their health as well as endangering the lives of their patients. And also, when you look at the private sector, I don't think anyone wants to be served by a waiter who's COVID positive, tested positive 5 days ago and is now wearing a mask. I think people want, people they interact with to be COVID negative.
Certainly that peace of mind means a lot for people. Thank you as always, Dr. Kate Tulenko there, CEO of CORVUS Health.